Hello, and welcome to Legally Speaking, a production of the Macomb County Bar Foundation and Lakeshore Legal Aid. According to the Legal Services Corporation, the opioid epidemic is a public health crisis, devastating urban, suburban, and rural communities across the United States. Before COVID-19, 115 Americans were dying each day from opioid overdose, and over 2 million Americans live with opioid-related substance use disorder. Social isolation during the pandemic has only furthered the harm that opioids have on individuals and families, creating issues of domestic violence, unemployment, and homelessness that compound this crisis. Experts are predicting that U.S. drug overdose deaths could reach an all-time high this year. Today on Legally Speaking, we'll discuss the impact the pandemic is having on the opioid crisis and what is being done to connect individuals and families with the help they need. I'm Ashley Lowe, the Chief Executive Officer of Lakeshore Legal Aid, a nonprofit law firm that provides free civil legal services to low-income people, seniors, and survivors of domestic violence and sexual assault throughout Michigan. Today, we're talking about the opioid crisis and how the pandemic is exacerbating an already destructive situation. We're joined by 3 experts on this crisis who will help us all learn more about the problem and the efforts to help those who are suffering. Our first guest is Dunya Barash. She's a supervisor of community organizing at CARE of Southeast Michigan. She's a social worker who develops and coordinates initiatives designed to prevent and combat drug addiction. She's a member of the Sterling Heights Drug-Free Coalition and a Teens Talking Truth advisor. Dunya, thanks so much for joining us on Legally Speaking.
Thanks for having me.
We're also joined today by Professor Lauren Rousseau of Western Michigan Cooley Law School, where she's the chair of the Civil Procedure and Evidence Departments. She writes and speaks extensively about addiction and the opioid epidemic. She was honored by Michigan Lawyers Weekly Women in the Law for her advocacy around addiction, treatment, and education. Professor Rousseau, it's great to have you on Legally Speaking.
Thank you so much for inviting me to this program.
And our third guest is Lieutenant Mario Bastianelli. He's with the Sterling Heights Police Department. He's got 21 years of experience in law enforcement, and he heads the Community Service and Internal Affairs Bureaus. He's the president of the Sterling Heights Drug-Free Coalition and the supervisor for the Comeback Quick Response Team. Lieutenant Bastianelli, thanks so much for being here.
Thanks for having me. I appreciate it.
So I'd like to start our discussion with Dunya Barash. Dunya, can you talk about what CARE does?
Yeah, I'd love to. So we are a substance use and prevention agency that serves Macomb County. And really our mission is to strengthen our communities by providing prevention, education, and services that improve the overall quality of people's lives. Some of the main things that we focus on as an agency are things like parenting classes and providing parents with the tools to be able to guide their children in making good and healthy decisions. And sometimes we also do parenting classes for parents that may be struggling with different things within the legal system with their children. A few other things that we do as well are student assistance with our school districts. So school districts have contracts with us where their students can come into our agency and receive assessments around mental health and different things that they may be struggling with. We also have a large prevention department, which is where I'm based out of, which has really 2 different departments. And one of them is community health educators, which go into the schools and provide education. We also go out into the community and do things like this, where we're able to provide community members with opportunities to learn about things like the opioid epidemic or vaping and different things like that. The community organizers, which is the group of individuals that I supervise, work together in different communities, 10 different communities in Macomb County, to try and come up with solutions around substance use. And then finally, we have peer recovery coaches at CARE, which is a huge component to individuals being successful within their recovery. And they work in the jails, in the hospitals, in community, and in different areas within our organization. And then we also do some clinical and treatment stuff as well. But lots of awesome things happening at CARE. We've grown so much within the past couple of years that I've been here. And really, we are just a resource for families and individuals that are looking for some help when you don't know where else to go.
Dunya, it sounds like you're really on the front lines in dealing with these issues. Can you talk about why addiction to opioids is such a serious problem?
So I was kind of thinking back and forth about how to answer this question, because addiction to almost anything of hard drugs is something that can be really severe. But what makes opioids different is the fact that we've seen so many individuals die so quickly with opioid abuse. And so because of fentanyl and different things that can be added to opioids, I think that's what makes it such a severe impact within our community. And then to couple that with the fact that there is this huge physical dependence, which makes it so hard for individuals to decide to go through recovery and start treatment, because while people may really want to get help and live a life without having to use substances, the consequence of that is going through detox and withdrawals and things like that cause someone to feel physically ill. And so a lot of times we see people continuing to use just so that they don't feel sick. And so I would say that's really the biggest, the severity around opioid use. And also important to mention that it can also happen to anyone. And we know that anyone can become addicted to opioids. And we've seen, the consequences of opioid use over the past 15 years, and how it can happen to anyone, any family, it doesn't matter who you are.
Right, absolutely. No one's safe, that's for sure. So can you talk, Dunya, about the pandemic and how that has really added to this crisis?
So just through research and being able to speak to people on the front lines, some of the things that we've heard is that people during the kind of the more alarming times of the pandemic in the beginning, we've seen that people were struggling to get into treatment, because I think treatment facilities were trying to figure out how they were going to physically distance and things like that. And not even just so much on the treatment side, but then if we think about families and their concerns of their loved one going into a place and not only struggling with a substance use disorder, but now potentially could get a virus that they could lose their life to. And so these two different things, I think, cause kind of an additional stress. Not only, were people worried about getting sick, but they also didn't have childcare, or still continue to may not have childcare. Someone could have been out of a job, but then the other person could be working. And so I think a lot of these different factors kind of caused individuals to either go back and forth if they were early in deciding whether or not to go to treatment. But then we also seen that individuals that were in the early stages of recovery were impacted by this as well.
Thanks, Dunya. And I've heard this quote, the opposite of addiction is connection. Can you talk about what that means?
So I really like this quote because having connections within the community is so important when you are in your early stages of recovery. Things like NA, AA meetings, having a sponsor, having places to go, being able to have support groups and individuals that are walking through the same steps as you or have before, make it really a lot easier for people to sustain recovery. And then sometimes the other thing that maybe we don't always think about is the recovery community may be really helpful in helping people sustain their recovery, because sometimes some of the homes that people come from, or maybe the environment and different things like that, may not be conducive to that. And so having an outlet and having a place and a community of people is so important to people maintaining recovery.
Dunya, thanks. Thanks for explaining all that. I'd like to switch over and talk to Professor Rousseau for a few minutes. Professor Rousseau, can you talk about how you first became involved in the opioid crisis?
Sure. So about 8 years ago now, I was legal guardian for a young man who had been my youngest son's best friend. They grew up together, went to school together, and he was pretty close with our family. His mother passed away unexpectedly, and I became his legal guardian, and he moved in with us. In grappling with his grief over his mother's death, he turned to drug use and ultimately became addicted to heroin. We went through a pretty crazy 2-year period where I was dealing with all of the things that family members deal with when we have a young person who's addicted to opioids. And there was, I was sort of a crash course of self-education to try to figure out how to handle the situation. And in retrospect, I'm sure I made a lot of mistakes. I've learned a lot since that period of time that makes me feel that I would do things a little bit differently today. Whether it would make a difference in the outcome of the situation, I don't know. In 2011, he was in and out of inpatient treatment twice. My insurance only provided about 2 weeks of inpatient treatment, which is a point I'd love to discuss further. He relapsed within 48 hours of each of those inpatient treatments. And ultimately on April 4th, 2012, he died. It was sort of an indirect result of his addiction. His addiction actually took him to a place where he was murdered. He was 19 years old. It was basically 4 days before his 20th birthday. So that experience was devastating to me, needless to say. As many family members feel when they are experiencing something like this, you look back at everything you've ever done to see whatever mistakes you might have made. You feel a lot of self-blame and a lot of failure. And I coped with that by getting involved in addiction work on a volunteer basis. So I began volunteering at Brighton Center for Recovery in their patient waiting room for about 6 months, and then ultimately joined the board of directors of Home of New Vision, which is an addiction treatment agency in Ann Arbor. I also spent some time on the board of directors for the Alliance of Coalitions for Healthy Communities, which is in Oakland County and is a substance abuse prevention organization primarily. And then ultimately I became involved with Families Against Narcotics. So Families Against Narcotics is a nonprofit organization that started in about 2008 to support families and individuals struggling with addiction. There are now 20 chapters approximately across Michigan. In 2016, I joined with a small group of people to launch the first FAN chapter in Wayne County. We launched that chapter in April 2017. I'm the president of that FAN chapter and have been since that time. And so FAN does a lot of different things to support both families who are struggling with addiction or people involved, loved ones who have struggled with addiction, as well as people in recovery and individuals who have struggled with addiction themselves.
Well, first of all, I want to thank you for sharing your personal story because I think it really has an impact when people understand, as Dunya said earlier, this is something that could happen to anyone. And we all have to look at the risk factors in our lives and think about what we can do to help prevent this. I would love to hear about Family Against Narcotics and what they're doing to help people.
Yeah, the organization's mission is essentially to provide education, resources, and support to families and individuals who've been impacted by addiction. And there are certain common things that all of the chapters do, and then there's certain different things that we do based on what we perceive to be the needs of the community. One thing that we all do is we have monthly educational public forums where we have speakers come and speak on various aspects related to addiction and recovery. Ours are the first Monday of every month. Our meetings took place live in Canton at Summit of the Park, but now because of the pandemic, we've gone online. We've been holding meetings virtually since April. And so again, our next one I think is December 7th. Our chapter also has 2 support groups that meet twice a month. One is a grief support group for people who've lost a loved one to addiction. That meeting went online for a period of time, but now it's meeting live again at the PC Alano Club in Canton, and it's the second and fourth Tuesday of every month in the evening. We also have a family support group that meets the same days, slightly different times, that are right now still meeting virtually, and that's to provide again support for families who are struggling with addicted loved ones. A couple of other things that we're doing. Recovery homes are a very important part of the recovery continuum for so many people. The time that you actually spend in treatment, particularly inpatient treatment, is so short that it really does nothing more than jumpstart your recovery. And you're still at a very early, fragile state at that point. Oftentimes going back to your normal home or the place where you came from is the worst thing in the world for you, because there's all kinds of triggers and maybe individuals who are using, and it makes it so much easier to relapse. Recovery homes are places where you can go that are focused on supporting recovery. And there's certain requirements in those homes about attending support meetings that again will help strengthen recovery, like NA or AA. You have to attend a certain number. And there are other things that happen with respect to those homes that are focused on accountability, like drug testing and curfews and things like that. And all of that is to strengthen recovery. Recovery homes are not deemed to be treatment, so they're not covered by insurance. And so there's a need for the person to be able to come up with the money to be able to live in a recovery home. And often coming out of treatment, the person has nothing. Addiction drives people to a place where they lose everything. They lose their money, they lose support, and they come out often with nothing. So our chapter is providing scholarships, and we've been doing this since about, I want to say April, up to a month of scholarships to people who are in need. We're working with 5 different recovery home organizations in Northwest Wayne County to provide that kind of support so people can move into those homes.
Thanks. And all that is such great information, I think, for people to know that there is help out there, but there's also this great need, right, for folks who maybe those resources are available, but they can't take advantage of them because either they don't have the coverage or the financial support to do that. I know you have been working with a high school that supports recovery. Can you talk a little bit about that?
Yeah, I haven't been working with the high school. It's more that I'm excited about this development. There's an organization called Wellspring Lutheran Services who is launching a recovery high school in Farmington Hills effective January. It's going to be virtual in January, and then in September, the plan is to go live. It'll be the first recovery high school in Michigan. So I've been doing this type of work with many addiction advocates and people who work in the field for the past 8 years. And during that period of time, there have been groups of people who have tried to make this happen, and it's never actually gotten off the ground. And finally, Wellspring Lutheran Services has made this happen.
That's wonderful. Thanks for sharing that. That's really exciting. I'd like to switch gears a little bit and talk to Lieutenant Bastianelli. Lieutenant, can you talk about your role as the president of the Sterling Heights Drug-Free Coalition and what made you take on that role?
Absolutely. Thank you for having me. I'm proud and honored to be able to speak on this topic that's so important and affects so many different people. So let me start really from the beginning in Sterling Heights to give you a good view of why we did what we did. So for the past couple of years, we have ended up changing over and getting a new chief, Chief Dale Dulczkowski, who's a very innovative and progressive chief. And in 2017, we realized, listen, we got to change it up. We got to do something different in Sterling Heights because we're losing the battle with the opiate epidemic. So in the mix of that and what I do, and we were trying to figure out, scratch our heads, like what can we do to give our public more opportunity, more resources. Lo and behold, appears Dunya Barash, who from Cara, Southeastern Michigan. She approaches and says, hey, listen, you guys should start a nonprofit organization, and called the Sterling Heights Drug-Free Coalition to provide education and resources to your public for addiction. So the chief was like, yep, we need to do this. And I oversee our community service bureau besides our internal affairs. So I oversee all of our community outreach stuff. So I'm like, I was on board from get-go. And if you get to know Dunya, she is a very hard worker and down for the cause of fighting this fight. And she's committed to our community and a lot of other communities also. So anyways, we started the Sterling Heights Drug-Free Coalition. We kicked it off. We've provided a lot of resources to our public, a lot of education. I think that was a good first step, right? But we noticed that it really wasn't moving the meter in regards to addiction and people overdosing in our community. Since 2017, we've averaged around 110 overdoses a year, a ton. We've averaged around 10 to 15 overdose deaths a year. We're losing the battle in Sterling Heights, right? So again, we're like, what steps can we take further to fight this opiate epidemic and save lives and help our community? So in late 2019, where myself and the chief, we were at the chief lunch in Macomb County. And then again, an opportunity presented itself. Linda Davis, who's the executive director of FAN. I'll tell you, I can't say enough great things about Families Against Narcotics. Amazing nonprofit organization. She comes there and she's like, hey, listen, we want to kick off a pilot program called the Comeback Quick Response Team that provides help and resources to people that recently survived an overdose within 72 hours. Man, as soon as she brought that up, I was like, the chief and I, we connected eyes, were like, oh, we got to do this program for sure. So we rushed to Linda, tried to be the first police department to get to her and say, listen, we want to start this in Sterling Heights. So planning went in place. February of 2020, we kicked off the Comeback Quick Response Team. With, obviously with FAN doing all the heavy lifting for the police department. We put together a great team. I have amazing officers that are committed in the program. And so this is what we did. We created the program to, within 72 hours of somebody overdosing, we bring the resources to their door. Essentially, if you know anything about Hopes on Handcuffs, and Lauren can speak a lot more on Hopes on Handcuffs, but another amazing program that allows people with addiction that want to seek treatment, they can come into any police department and get help. Well, essentially, we're bringing Hopes on Handcuffs to the door of these people. And since we've kicked it off, we've had, from the day one that we started this program in February, we have had amazing success, immediately bringing people, getting them into treatment. And, the great thing, it's free. And since we've kicked off the program, and I'm going off the top of my head, and I apologize, we're around 100, in Sterling Heights alone, we're around 140 visits to people that have suffered an overdose and or they may suffer from addiction. And our team has made contact with people. And with that, we've had around a range of 65 to 75% success rate of getting people into treatment upon our visit. So with that many people in contact since February, and now, mind you, because of COVID, like every community, we were shut down. So actually our program shut down for a couple months in the mix of this. So we had it going for about 5 weeks and we had to shut down COVID. And we were having great success. It was disappointing with COVID. So we were like, I was chomping at the bit. I'm like, you've got to get this going. People are suffering. They're not getting the help they need. So anyways, we could continue the program and we ended up, we're just knocking it out of the park. Because of our success, look, other police departments, they take notice, right? They see things that are being done differently and that are successful. Since February, 8 other police departments have signed on, have mirrored their programs to begin their quick response team, and they've implemented their programs in their community. 8 others in Michigan. It's growing like wildfire. And I'm telling you, we've created a recipe for success of helping people with addiction. And I'm proud to be able to say and sit here and talk about it because it's an amazing program. It really is. It's making a difference.
That's wonderful. That's great to hear. And so Lieutenant, have you seen a difference in your work in the field in kind of pre-pandemic? You didn't have much time pre-pandemic in this program, but have you seen a difference in pre-pandemic versus now, what people are experiencing?
Absolutely. One, our overdoses are going down. That's number one, right? That is our objective. We want to save lives. That's for sure happening. And then let alone the fact is because of the fact you're helping people with addiction, and unfortunately addiction and crime go hand in hand. And now we're taking a different approach. I'm so glad that we're doing this. Look, law enforcement is evolving and we have to provide different services to our community. And this is a need. So because of that, and we're providing this and you're helping people with addiction, they're less likely going to end up committing crimes. And I want to talk about that for a second if I can. Yeah. 2018, FBI reported stats, 1.6 million drug offense arrests in the country, 1.6 million. Now, anybody who wants to talk about, and I'd like to say that we need to change this in law enforcement, is that we need to take a different approach. Throwing people in jail is not working, okay? And we're seeing where it's a trend that is now happening across the nation of law enforcement. And listen, we need to provide treatment. And I say this when we talk to these other police departments. I mean, listen, you want to affect crime in your community and you want to lower crime in your community, take care of the addiction problem. Because if you look at it, a lot of time the core problem that people are committing crimes are stemming from addiction. If you take care of the core problem, you're going to stop the crime. So, and I think people across the board are realizing that that's the route we need to go, doing something different outside the box. And I have to say, it's amazing. It's successful. And we're going to see the numbers coming forward. Within the next year, you'll see that crime rates are going down, overdoses are going down. It's a more proactive, aggressive approach on this and providing people the much needed help that they need.
That's great. That's right. It's exciting to see that change happening, and not just in your department, but in other departments across the state. So hopefully things will start to make a shift as we go forward.
Oh, for sure they will. For sure they will.
I want to give each of our guests an opportunity to talk just for a moment about if there's anything that you want folks to know about resources that are available or programs that they can take advantage of. Dunya, we didn't get a chance to talk about Narcan, but you might want to talk a little bit about that and how folks can access those resources. So Dunya, do you want to start?
Yeah, so throughout the course of this pandemic, and even prior to that, we've tried to come up with different strategies to reach the community to provide them with Narcan. Originally with the Sterling Heights Drug Free Coalition, we started hosting Narcan trainings twice a year to try and get our volunteers within the community Narcan trained. And the way that we talk about Narcan is very similar to CPR or any other life-saving skills that you would have in your toolkit. And so currently, we have pop-ups, Narcan pop-ups happening throughout the community. They are happening all throughout Macomb County. They've been extremely successful. We recently did one off of the Gratiot corridor, and were able to distribute around 70 different Narcan kits to individuals that were either walking, pulled up in their cars, seeing the sign that said free Narcan, and really just get this life-saving tool out to our community members.
Great. Thank you, Dunya. I appreciate that. Lauren, do you have anything you want to add in closing?
Sure. I would like to touch on the program that Lieutenant Mario, is it Bastianelli? I believe I pronounced that right, referred to at FAN. I had mentioned some of the services that Families Against Narcotics provides. He had talked about the new comeback program, which is very exciting. And it is pretty much, it's something that has started in Macomb County with the Macomb County FAN chapter, and is going to spread throughout the other FAN chapters throughout the state. But the other program I mentioned that's been around a bit longer, since February 2017, is the Hope Not Handcuffs program. And so that is an initiative of Families Against Narcotics partnering with participating police stations. Families Against Narcotics trains volunteers in how to assist people seeking treatment for addiction into available treatment options, treatment facilities, and they do this at the police stations. That's how the program was conceived, so that somebody who's struggling with addiction doesn't have to try to figure out the network and sort of morass of addiction treatment that might or might not be available to them. They can just walk into a participating police station, say they want help through this program, and then the person who's there at the police station will contact FAN, they'll contact a volunteer coordinator, and they'll send what we refer to as an angel to the police station to meet with that person, and often can get them into treatment that same day. So that's a program that's been around for a while. The pandemic shut it down in some places to some degree, but it's always been available online. People can still go to the Families Against Narcotics website and access an application for Hope Not Handcuffs that way if they're not able to do it through the police station. Our chapter in Northwest Wayne is launching the Hope Not Handcuffs program at 2 new police stations in the middle of this month, the City of Wayne and also the Garden City Police Station.
Great.
So,
thank you so much. Thanks for sharing all those resources. I appreciate it. Well, I can't thank you all enough for sharing your expertise about the opioid epidemic and the resources that are available. I know this information is critical to our audience and hopefully will help folks reach out and to get the help that they need. And thank you all for joining us on Legally Speaking.